नमस्कार, सत श्री अकाल, आदाब, गुड मॉर्निंग, गुड आफ्टरनून एंड गुड इवनिंग, जहां से भी आप हमें सुन रहे हैं. थैंक यू सो मच फॉर ज्वाइनिंग आवर लाइव सेशन. माय नेम इज कुंजन, हमें आपके होस्ट एंड दोस्त for this FB live session right now. We are live on Facebook, YouTube, LinkedIn, Twitter, and Insta. So please hop on your social media channel where we bring to you interesting topic. Indian origin folks living in US. If parents are visiting from India and you are looking for medical consultation, well, look no further. eGlobalDoctors has your back. In today's live session, we will be exploring and providing more information about celiac disease in conversation with Dr. Abhinand Reddy. Dr. Abhinand Reddy did his schooling at Sainik School, Kurukonda, which is part of army-based school, which laid the backbone of his education and taught him the most important thing in life, which is discipline. Did it MBBS and MD General Medicine at Osamiya Medical College, one of the prestigious medical college in India, currently practicing gastroenterology at Apollo Hospital, Hyderabad. It's really nice to meet you virtually, doctor. How are you doing? Thank you for sparing time for us.
I'm good. Thank you.
Thank you. And I know you're super duper busy. We really appreciate that you take time for us. So welcome to our Facebook, Instagram, YouTube, Twitter, and LinkedIn Live. So what do you say, doctor? Shall we dive into our today's topic?
Yeah, sure.
Okay. So thank you so much. So I'm going to start with a very basic topic. So if somebody is actually joining us right now, we are in conversation with Dr. Abhinandan and we are talking about celiac disease. So what is celiac disease, doctor?
So it's celiac disease. It's basically a gluten-sensitive disorder. In some individuals, whenever you eat any products containing gluten, it will trigger an allergic reaction in only susceptible individuals. So what exactly is gluten? It's a protein found in foods which we commonly eat, like oats, wheat, barley, and rye.
Okay, well, it's actually good to know. So it's a gluten disorder, you mentioned?
Yes.
Okay. So if people who are listening,
disorder.
gluten sensitive disorder.
Yes,
okay.
Gluten sensitivity.
Okay. So me, a common person who doesn't know much about medicine, this is not a term that I have heard. It's not very common. So all of a sudden, why are we discussing about it? Is this something which is becoming a serious problem?
No, not exactly serious, but the people having this disease should definitely know about it. Because what exactly happens is when you eat something which has gluten, it will trigger an immune response in your small intestine. And if this reaction happens again and again, the intestinal lining will get damaged, preventing the absorption of nutrients and vitamins, causing malabsorption and other symptoms too.
Okay, that's actually good to know. So now at least we know that what kind of disease this is. So let's talk about and shift our course. What are the symptoms of this disease?
The person may have a variety of symptoms. The person may have diarrhea, weight loss, bloating, and gas sensation in the stomach. Some people may also have constipation, fatigue, and stomach pain, oral ulcers. Apart from this, some people will also have anemia, which is usually due to iron deficiency, and even some people have easy fractures due to calcium deficiencies, and rarely amenorrhea, impotence, and joint pains too. There are some people may have skin disorder called dermatitis herpetiformis. In this, they will have blisters and itching over the skin.
So I'm going to ask you a follow-up question. Something for people like me who are very common people, doesn't understand the fancy terms. So I am anemic. I have been anemic ever since I was a little girl. Sometimes my stomach does get upset or constipated. So if I have these symptoms, do I have celiac disease?
No. Anemia has 1,000 reasons. Celiac disease is just one of them. And all the patients of celiac disease does not have anemia. Some people may have, but I think you should definitely meet your doctor to get your anemia evaluated.
I will take you up on that. Thank you. That's a good reminder. I'll definitely do that. So if somebody who's actually facing these celiac disease symptoms that you just mentioned, how would I know who to go and see? Do I go and see my primary physician? Where do I go?
You should go to a physician or a gastroenterologist.
Okay, so physician and so that's your
Physician,
specialty.
or a gastroenterologist, anybody would do.
Okay. So people who are listening to us or joining us right now, we are in conversation with Dr. Abhinand, and we are talking about celiac disease. And this is one of his specialties. So if you have any of these symptoms, you know who to go to. So what exactly, when somebody comes to you, what exactly do you do? Will you prescribe medicines? There are any blood tests, or what happens?
In order to know whether the patient or the person has the disease or not, we will run through some tests. Some people may also require an endoscopic biopsy for confirmation.
Okay, so the first step is go to you, and then you will figure it out what kind of test you'll be running on them.
That depends on, that varies from patient to patient, but we will do some tests.
Okay, so another question, is there an age, like after certain age, the disease kicks in, or it can just kick in anytime?
No, it can. I saw many children I saw many children with celiac disease. If the child is having chronic diarrhea, swollen belly, pale colored stools, then we should really get suspicious. The child may not grow according to his age. They will have some vitamin deficiencies, short stature, delayed puberty. And one more interesting fact is children getting recurrent rotavirus infection are more likely to develop celiac disease. So vaccination against rotavirus is protective.
Okay, so that's one of the causes in kids.
No, it's not one of the causes. It is linked in the causation in the what we call in the. It is more common in recurrent rotavirus infection.
Got it. Understood. Thank you for that clarification. So since we talked about children or kids, my next question is this something that runs in the family? Is it inherited?
Not exactly an inherited disorder, but definitely has a genetic component. It is always better to get tested if someone in your family has this issue, as there is a 10% chance of having your first degree relative having this disease. If the parent has celiac disease, then the child has a 10% chance of having the disease, and vice versa too.
Okay, and I just realized that
there is another entity which is very similar to celiac disease. This is called gluten intolerance. The only difference is all the lab tests and even biopsy comes negative in gluten intolerance, but the patient will continue to have symptoms.
Wonderful. Thank you so much for that. So if people are joining us, you know what you have to do if you see these symptoms. And my apologies. Earlier, I mispronounced your name. So sorry about that. So I also want to tell people that at eGlobalDoctors, we are constantly working towards to improve and strive for best prescription shipping services are available in Georgia state only. eGlobalDoctors have partnered with Sugar Pharmacy, Georgia, to deliver the medicines to the people to the Metro Atlanta local community. Now, again, the service is only available to Georgia state only. It's not available outside of Atlanta, but you know the way eGlobal is going, maybe when we come and meet you next time, we might have other information and other states available for you. So going back to our topic, doctor, now that we know a little bit about disease, we know what the symptoms are, what's the treatment for celiac disease?
The treatment is very simple. Avoid gluten, avoid problems. If you have any vitamin deficiencies, we can supplement them accordingly. But the ultimate solution is avoiding gluten. That's all. That is the only treatment.
Any product where or stuff where gluten is available and people don't know, so any product they should avoid because of gluten?
As I told you, oats, barley, rye, and many foods have hidden gluten in them. So it is definitely advisable to check the label before you take it.
Okay, that's a wonderful information. So make sure whatever you're buying off the counter, just read the ingredients and be sure and stay away from gluten. So is it
And
reversible?
and one more thing, stay away from gluten is not universal. Only those people with celiac disease must stay away from gluten. And nowadays, it's becoming a fashion that everybody is trying to stay away from gluten. No, that is not required.
Okay,
Only
so
in the susceptible individuals, if you are having any symptoms after taking gluten, then yes, you should stay away from gluten, but after
got
getting
it.
tested.
Okay, so is this disease reversible?
Once, yes, it is reversible. Once the patient stops taking gluten, it is reversible. It may take time, but yes, it is reversible.
Okay, perfect. My next question to you is, if the patient is continuing to having the symptoms despite of having a gluten-free diet and all the things that you mentioned, what should they do?
Some products like toothpaste, ice creams, candies, even some vitamin supplements have hidden gluten in them. So it is always better to look at the label before eating anything. And if you are continuing to have symptoms, even after avoiding gluten, then I think you should consult your doctor.
It's time to go see the expert if it doesn't stop.
No, no,
So,
yeah, tell
go
me.
ahead.
Continue.
Okay. Okay. We talked about if the disease is reversible, you're prescribed some tests and medications. Um, I'm thinking that what about steroids? Are steroids helpful
Uh,
in this case?
yes, they are helpful, but only if the patient is having a severe flare. Not all patients with celiac disease require steroids, but ultimate treatment would be avoiding gluten. And one more thing, do not take steroids without any prescription.
That's a very valuable advice. So whatever you take, just go with the what doctor is saying. So
What
um,
your physician or gastroenterologist says, just blindly follow them. That's all.
okay. So we know now that if a person suffering from celiac disease, stay away from gluten. What are other foods or food items that actually that person can take?
Oh, yes, he can take anything: rice, millet, soya, corn, all vegetables, meat. And there is a major misconception that milk and dairy products have gluten in them. But that's not true. That does not have gluten in them. You can happily take them. Milk and milk products.
That's actually interesting. I was also one of them thinking that, oh, if you take milk and
No, no,
coffee, and if you're no, so you can have
no,
dairy
that's not true.
products.
That's not true.
That's definitely a myth busted right here at our live that milk does not have gluten. You can take milk
You
and
can
don't
take it.
worry about
You
it.
can take all fruits. You can take all vegetables. You can take meat.
Wonderful.
Avoid
So no
oats,
diet
barley,
restrictions.
rye. No diet restriction. Just avoid oats, barley, rye. That's all.
Okay,
Wheat.
wonderful. So is there any prevention? Whenever we talk about disease, we always say that, okay, it's going to stay. So are there any preventive measures?
No, as I told you, it has a genetic component. So once you have the disease, you have to live with it. But yes, you can definitely have a pretty normal life if you are completely gluten free.
Okay, so if we are gluten free, then we can go about doing our days and chores normally like other people.
You are completely all right.
Okay, so I we have been talking about gluten. So I'm gonna go and ask you a question on the gluten. So what is the difference? Like you used a word gluten's intolerance. So what does it mean actually?
Basically, your body is not accepting gluten in the diet. That's all. So it's trying to go against gluten. In this process, your intestines are getting damaged.
Because of the
That is the
gluten intake.
whole pathogenesis behind celiac disease. See, some
Understood.
people have allergy to potatoes, some people may have allergy to peanuts, Similarly, the patients of celiac disease are having allergy to gluten. That's all. It is very simple to explain.
Okay. So let me check if we have any questions during our live session. So when you, I do see one question. Okay, so I'm going to ask, and I'm looking here because my screen is here for that particular question. So what are the type of blood test? Will a blood test required to get tested for celiac disease?
Yes, blood tests are required. We'll test for antibodies, various antibodies. We will test if the antibodies come positive or negative, and depending upon the patient situation, they may also require an endoscopy and an endoscopic biopsy. Yes, blood tests are required.
Okay, perfect. So hopefully whoever asked this question did get the answer that yes, it is one of the requirements. I don't see any more questions. So I'm going to talk a little bit about eGlobal, and then we'll be wrapping our session, Doctor. So eGlobalDoctors have started a new diet consultation, nutrition coaching to reverse chronic disease, and you can get started with 2 free diet consultation. They have multilingual nutritional coaches, so language is not a problem. Diabetes remission, detox program, weight loss, gut health, child nutrition are few to be named, along with several others diet programs. The programs are 3-week or 3 months, depending what your need is. How does it work? At eGlobal, they help people understand the root cause of the problem. They take in-depth case study, no fat diets are prescribed, help people understand mindful eating. The recommendations are based on their individual taste and preferences. The approach is totally scientific along with some holistic transformation. If you're still thinking about it, you can schedule a free consultation with their top nutritional coaches. Visit and register today at eglobaldoctors.com and book your appointment. So, like I said, the new feature is prescription shipping services. It's only available for Georgia state. So if you live in Georgia, you are in for a treat. eGlobalDoctors have partners with Sugar Pharmacy to deliver medicines to the people to Metro Atlanta local community. The service is not available to patients outside of Atlanta at this point of time. So before I let you go, Dr. Abhinand, any word of wisdom that you want to share with our viewers?
Word of wisdom. If you are facing any problems, first of all, do not consult Dr. Google. It will do more harm than good. Consult your physician or anybody who is actually qualified to look at you, not Google. That's all.
That's actually wonderful. But probably I thought you were talking to me. Kunjan, stop Googling stuff. That's a wonderful information. Well, there you have it. This is what we have for you today. This is Kunjan signing off. See you next time. Sayonara till we meet again. If you are in California, stay dry. And if you are in India, make sure that you are warm enough. Keep smiling always. Namaskar.